Welcome back, listeners. It looks like we're diving into some really important stuff today, the world of pharmacology, specifically mnemonics for medications,
hmm
especially for the NCLEX, right?
Yeah, it looks like it.
We're here to help sort through all these mnemonics and stuff. So what's so fascinating about using mnemonics anyway?
Well, they're a really cool way to take rote memorization and make it way more engaging. It's about creating connections that you remember that stick.
Let's start with something I'm sure everyone's heard of, beta blockers, which usually end in, a lull.
Right. Beta blockers are often used for things like hypertension, angina, and arrhythmias. They work by blocking epinephrine's effects,
Epinephrine.
which reduces the strain on the heart.
Okay. And I've heard of the mnemonic beta to remember their potential effects. Bradycardia, exacerbation of heart failure, tiredness, and asthma for those asthmatic patients. But why exactly those effects?
Well, okay, so bradycardia, which is a slowed heart rate, kind of makes sense, right? Because beta blockers directly target the heart. And then exacerbation of heart failure, that's a concern because if the heart is already having issues, suppressing it further could be really bad.
Right.
Tiredness is also pretty common because the body's energy expenditure is lowered.
Makes sense.
And then asthma, that's why we got to be careful with asthmatic patients
Right. Yeah.
because beta blockers can make the airways constrict and that makes breathing a lot harder.
So that beta mnemonic really connects to, actual physiology.
Yeah.
Okay, awesome. What about ACE inhibitors? Those usually end in frontal, right?
Yeah, for like lisinopril, for example, they're usually prescribed for hypertension and heart failure.
But,
And they inhibit the angiotensin converting enzyme,
oh, wow.
which it plays a key role in blood pressure regulation.
Oh, I see.
Yeah.
That makes sense. And the mnemonic April-Cov? I
Yeah.
like that one. A for angioedema, P for potassium levels, R for renal function, I for initial hypotension, L for, lisinopril, and of course cough, because that's like a really common side effect.
Right.
But why is that cough so prevalent?
Oh. Well, that cough is actually a hint about how the medication works.
Really?
ACE inhibitors can cause a buildup of bradykinin, which can cause vasodilation, and also it triggers coughing. So even though it's annoying, it means the medication is working.
So it's not just some random side effect. It's part of how the drug does its thing.
Exactly.
That's interesting.
Go-
Okay, let's talk about something, pretty crucial for diabetes,
Yeah,
the different types of insulin.
right. So understanding the onset, peak, and duration for each type is really important for controlling blood sugar. We have fast-acting insulins like Lispro, Aspart, Glucine.
Wow.
Then there's intermediate-acting, which is NPH. And finally, there's long-acting, like Glargine and Detemir. Each one has a unique role in, mimicking how the body releases insulin naturally.
Oh, okay.
Yeah.
So the mnemonic for this one is short-staffed nurses went rapidly to intermediate care before long shifts.
Yeah.
So short-staffed nurses are regular insulin, went rapidly for the fast-acting ones. Intermediate care is for NPH insulin. And finally, it's before long shifts for our long-acting insulins, like Glargine and Detemir.
Yeah.
But what's the actual difference in how these insulins work?
Well, regular insulin works, over a longer time.
Right.
While rapid-acting insulins are absorbed really quickly, so they're perfect for mealtime dosing.
Right.
NPH, on the other hand, provides a steady background level of insulin. And long-acting insulins, they mimic the body's natural basal insulin release.
So they all have their own specific roles in blood sugar management.
Exactly.
That's really interesting. Now let's talk about calcium channel blockers, which are often used for hypertension and arrhythmias, right?
Yeah, right. And the mnemonic for this one is very nice drugs.
The radio drugs.
It helps us remember the three main types: verapamil, nifedipine, and diltiazem. They work by blocking calcium channels in the heart and blood vessels.
Okay.
And this leads to relaxation and widening of those vessels.
Okay, so the mnemonic is pretty catchy, but why are side effects like hypotension, bradycardia, and constipation so common?
Well, when the blood vessels relax, it can lead to hypotension or
Right.
low blood pressure.
Right.
Bradycardia, which is a slowed heart rate, can happen because calcium plays a role in how the heart muscle contracts.
Okay.
And then constipation happens because the medication also affects the smooth muscle in the digestive tract, which slows down bowel movements.
So those side effects are all connected to how the drug actually works in the body.
Exactly.
Okay. It's amazing how understanding the why makes it easier to remember the effects.
Yeah.
Okay, let's move on to potassium-sparing diuretics.
Okay. These help the body hold on to potassium while getting rid of excess fluid. The mnemonic is take a seat.
Take a seat.
Yeah. It stands for spironolactone, eplerenone, amiloride, and triamterene.
So why is potassium sparing so important, and what happens if it goes wrong?
Well, potassium is really important for, nerve and muscle function, especially in the heart. If potassium levels get too high, it can mess up the heart's rhythm, which can be really dangerous.
Okay, that makes sense. Let's talk about a medication that needs to be monitored really closely. Digoxin.
Right, digoxin. It's used for things like heart failure and atrial fibrillation, but it has what's called a narrow therapeutic range, meaning the difference between a safe dose and a toxic dose can be pretty small.
So that's where the mnemonic digoxin vision goes yellow comes in.
Exactly. It points out the main symptom of digoxin toxicity, which is vision changes, like seeing yellow halos around lights.
Oh, wow.
Yeah.
That's pretty specific.
It's not just vision changes, though. There's also nausea, vomiting, and it can even cause life-threatening heart rhythm problems.
So recognizing those early signs is super important for early intervention.
Okay, let's switch gears to statins. Those are the medications that help lower cholesterol. Right. Statins, like atorvastatin and simvastatin, are really important for managing cholesterol and preventing heart attacks and strokes. The mnemonic for these is statins save lives at night. It reminds us that they're best taken at night when cholesterol production is at its highest.
Oh, okay. I actually didn't know that. I've heard of people getting muscle aches with statins, though. Is that common?
Muscle pain is a potential side effect, yeah,
Okay.
but it's usually pretty mild. In rare cases, it could be a sign of something more serious, so it's important to, tell your doctor about any unusual muscle pain.
Got it. So let's talk about anticholinergic effects. That mnemonic is pretty memorable. Can't see, can't pee, can't spit, can't sure.
Yeah, it's definitely memorable, and it highlights the classic anticholinergic side effects, blurred vision, urinary retention, dry mouth, and constipation.
Right.
These happen because of the blockage of acetylcholine, which is a neurotransmitter that's involved in a lot of bodily functions.
So understanding these side effects can help people manage them, right?
Yeah.
Okay. So what about loop diuretics?
Loop diuretics like furosemide are really strong medications that help the body get rid of excess fluid. They're used for things like edema and hypertension.
Right. And the mnemonic loops lose everything is a good reminder that they can deplete electrolytes, especially potassium, sodium, and calcium.
Exactly.
Why is that depletion so concerning?
Electrolytes are essential for maintaining fluid balance and nerve function, and muscle contractions too, especially in the heart. So if you have severe electrolyte imbalances, it can lead to a lot of complications.
So monitoring those electrolyte levels is really important for patients taking loop diuretics.
Absolutely.
Okay, last but not least, let's discuss opioids, which are powerful painkillers that need to be prescribed and used very carefully.
Yeah, opioids like morphine and oxycodone are effective for managing moderate to severe pain, but they also come with some pretty serious risks. Things like respiratory depression, addiction, and sedation.
The mnemonic crawl really helps to remember those. Constipation, respiratory depression, addiction risk, watch for sedation, and low blood pressure.
Yeah, exactly.
But what makes opioids so likely to cause these effects?
Well, opioids work by binding to opioid receptors in the brain, spinal cord, and other parts of the body. This binding not only blocks pain signals, but also affects other systems, which is why we see those side effects. For example, they slow down the central nervous system, which can cause respiratory depression and sedation. And then they also slow down the digestive tract, which leads to constipation.
It's a good reminder that powerful medications like these require careful monitoring and patient education. We've talked about a lot of mnemonics and how they relate to the mechanisms and side effects of these drugs. But how does all this actually play out in a real-world scenario? Like when you're facing an NCLEX question.
That's a great question. So imagine you see this question. A nurse is caring for a patient receiving spironolactone. Which assessment finding requires immediate intervention?
Okay, so we're dealing with spironolactone. What should we be looking out for?
Right.
Let's say the answer choices are a potassium level of 5.8 mmHg, B, blood pressure of 1130/70 mmHg, C, heart rate of 76 BPM, D, sodium level of 135 mmHg.
This is where those mnemonics come in handy. Remember, take a seat.
Right. Spironolactone is one of the seat drugs, so it's a potassium-sparing diuretic. That's kind of a red flag when we look at those answers.
Exactly. Option A, a potassium level of 5.8 millieql immediately jumps out. That's really high, indicating hyperkalemia, which is a potentially dangerous condition.
So because of the mnemonic, we can connect the dots. Spironolactone, potassium sparing, and the importance of a high potassium level.
Right.
Answer A definitely needs immediate intervention.
Yeah, that's a perfect example of how mnemonics can help you break down NCLEX rate questions and make those connections to get the right answer.
It's like having a cheat sheet in your brain to navigate these tricky questions. So these mnemonics are super helpful for, remembering stuff. And they can even be important in a clinical setting.
Absolutely. They're not just about recalling information. They help you understand the principles behind pharmacology, which is crucial for safe and effective patient care.
We've gone through a bunch of mnemonics today, but have you come across any, really creative or unusual ones you can share?
Oh, there are tons out there. One that comes to mind is for the cranial nerves. It's pretty silly, but it works. Oh, to touch and feel. Very good. Velvet, heaven.
Wow, that's a mouthful.
Each word stands for a cranial nerve in order. Olfactory, optic, oculomotor, trochlear, trigeminal abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, hypoglossal.
That's quite a tongue twister.
Yeah.
But yeah, I can see how that image could help you remember the order.
Yeah.
It reminds me of one I saw for the branches of the facial nerve. 2 zebras bit my cat. Temporal, zygomatic, buccal, mandibular, cervical.
Exactly. The sillier, the better. And that's the great thing about mnemonics. You can find ones that are already out there, or you can even make up your own to match how you learn best.
That's a great point. If the existing mnemonics don't quite click for you, why not make your own, right? It's more personal, and it makes you think harder about the information.
I totally agree. Creating your own mnemonics is a fantastic way to learn. It makes you figure out the key points and come up with those memorable connections. It turns studying into a more active process. It's not just passive anymore.
We've definitely explored a lot today, talking about different mnemonics and how they're used. But this is just the beginning. There's so many memory tools out there just waiting to be discovered.
And the more you explore and try different things, the better you'll get at mastering all the intricacies of pharmacology.
Well, that wraps up our deep dive into mnemonics for today. We hope these memory tricks are helpful and maybe even a little fun. Keep learning and exploring, and we'll see you on our next deep dive.